Welcome to the second video in the Preop and Discharge Instructions series. This video will cover post-op medications and activity after surgery. Upon discharge after surgery, you will receive a list of which of your regular medications to resume, and which to stop. You can swallow pills of any size except for vitamins. Please do not cut or crush your medications. Please note that this is a change in our protocol, as in the past we did recommend crushing larger pills, but this is no longer the case. When you leave the office after your consent visit, you should have at least 4 prescriptions. All patients will receive pain medications, 2 nausea medications, and a medication to reduce spasms. Some patients will also receive a prescription for an acid reducer. It is important to note that prescriptions for pain medications expire after 14 days, so please get them filled immediately. Patients who are at high risk for blood clots after surgery may be prescribed a blood thinner called Lovenox or heparin. These injections are to be done for 2 to 4 weeks after surgery. For a tutorial on how to do your injections, go to loseweightcincy.com/Lovenox. With regard to vitamins after surgery, you will need to start sublingual vitamin B12 on post-op day 7. Sublingual means that it is dissolved under the tongue and not swallowed. Do not start any of your other vitamins until instructed by one of our dietitians. Typically these are started 4 weeks after surgery. With regard to pain, naturally some is to be expected after surgery. Mostly it will be around the area of your incisions, but left shoulder and neck pain is common also. This is mostly from the carbon dioxide gas that is used during the procedure. Lap band patients will typically have the most pain near where the port site is located, which is usually just above and to the right of the belly button. You will also feel a hard lump there, which is normal. This is the lap band port. Now let's talk about your incision care. You can remove the surgical dressings if they are still present when you get home. However, you should leave the steri strips, which are like small pieces of tape directly on the skin, for 10 to 14 days. It's fine to take a shower right away, but no baths or swimming until at least 14 days after surgery. If you have excessive drainage or redness from any of your incisions, please call us. It is also helpful, if you are having an issue with your incisions, to snap a picture of it with your phone and send it to provider@goreweightloss.com. After surgery, please avoid driving for at least 72 hours and make sure you are completely off your pain medications. Take it easy at first, but it is important to take frequent short walks to prevent blood clots. If you're an out-of-town patient and have a long drive home, please take frequent breaks with short walks. Lastly, if you were given an incentive spirometer, pictured on the screen, please take it home with you and continue to use it frequently for the first week after surgery. This can help prevent post-operative pulmonary issues. With regard to lifting, we recommend limiting to 10 pounds for every week after surgery. So in the first week limit to 10 pounds, in the second week 20 pounds, and so on. After the 4th week there are no lifting or exercise restrictions. Light cardio exercise can resume 7 to 14 days after surgery, depending on how you are feeling. And lastly, typical return to work is 1 to 2 weeks for light duty or desk jobs, and 3 to 4 weeks for physically active or lifting jobs. Constipation is a common issue after surgery. No bowel movement for up to 5 days is very common and not a concern. If you feel constipated, you can start Miralax powder the day after surgery. If you haven't had results within a few days, add milk of magnesia 2 tablespoons twice a day, and continue the Miralax. If you still haven't had results within 48 hours, add 2 daily Dulcolax suppositories. If you feel bloated or have gas pains after surgery, this is very common and also not a major concern. Frequent short walks helps to reduce these symptoms, but if you feel it is not improving, try over-the-counter Mylicon or Gasex strips. Over-the-counter Aleve can help as well, but not if you are a gastric bypass patient, as it is a non-steroidal anti-inflammatory medication. Vomiting or dry heaving can occur after surgery, especially in the first 48 hours. If this is happening only occasionally, it is no worry. Try to identify the source of the vomiting, as perhaps you are eating or drinking too quickly. If vomiting occurs, wait a few hours, then try 1 ounce of sugar-free liquid. If this stays down, then stick with small sips of liquids only for the next 24 hours. If vomiting is persistent, or it is a black, bloody, or coffee ground appearance, please call the office. With regard to pregnancy after surgery, it is critical for females to avoid getting pregnant for at least 18 months after any type of weight loss surgery. Of note, fertility can increase significantly with weight loss, and it is not uncommon for women who've had fertility issues in the past to report an unexpected pregnancy if they are not using contraception after surgery. Your first post-op check should be around 7 days after surgery. If you live more than an hour away from our main office or satellite clinics, we can arrange to do this by phone or virtual visit. If you are doing a phone visit, we will need to see a picture of your incisions to make sure they are healing well, so please email one to provider@curryweightloss.com. Also, please arrange for a phone follow-up or virtual visit with one of our dietitians. If you have any chronic medical issues, it is also advisable to make an appointment with your primary care physician for around 14 days after surgery, especially if you take blood pressure or diabetes medications. For lap band patients, the first band adjustment is done 4 weeks after surgery, and it should be done at the Cincinnati office where we have our fluoroscopy machine. The second adjustment is usually done 4 weeks after the first, then the subsequent adjustments are 5 or 6 weeks later. If you are coming in for an adjustment, please avoid solid food prior to the appointment. Liquids or pureed foods are okay. After a band adjustment, you will need to follow a liquid diet for 24 hours, followed by pureed for 24 hours, then solids. Please know that our team is available around the clock for any urgent issues or emergencies. You should call us immediately if you have any bleeding issues such as oozing from the incisions, vomiting blood, or blood in the stool. Also call us if you have any signs of infection such as a prolonged fever, redness, swelling, heat, or excess pain at the incisions, or drainage from an incision with pus or foul odor. Other reasons to call are separating or opening of an incision, nausea or vomiting not relieved by medication, pain not relieved by medication, or the new onset of calf pain or leg swelling. The most important thing to remember from this entire presentation is to just call us if anything doesn't seem right. Congratulations on completing the first video. Please watch the next and final video in this series entitled Post-Op Diet Progression.